All right, friends, it's Dr. Frank here. We are at PFRANKMD, and I'm with Nurse Jen here at Bomb Mass Skin, and we're going to do a little something called Case of the Week. And I really wanted to pick a patient that is very common to PFRANKMD. This is a patient who comes in complaining of scars and acne. And one of the things you have to really pay attention to is we are treating a medical condition. If you just treat the scars by itself and the acne keeps coming, the patient's not going to get anything that's long-lasting, nothing effective, and certainly you're going to keep having the problem. You can't just keep putting a Band-Aid on the issue. So we did a bunch of things here, and there's never any one treatment that is going to be the end-all for anything. So first we treat her medically, and then we treat her with lasers. So Jen, talk a little bit about what we did medically first.
Sure. So this patient not only has active acne, but she also has a history of melasma. So we were trying to treat her in a safe, effective way, and we started with some oral therapy. We used topical and oral tranexamic acid.
Which is a great medicine, by the way,
Yes.
which is non-sun sensitizing. There's oral and topical versions of this, and you can stay on it topically, unlimited, and orally for a limited period of time.
Exactly. And then because her acne is primarily along her jawline, we know that there's a hormonal component to it, so we gave her oral spironolactone. And then in terms of the lasers, we started her out with an Aerolase since she does have some red and some brown pigment, and also it'll help treat the active acne. We followed that up with a very light Permea, and subsequently she came back 4 weeks later. We treated her with additional lightening agents and then followed up with the laser genesis to further treat some of the residual redness and some of the scars.
Yeah, so it sounds all very complicated, and there were several lasers involved, but none of them really gave a significant amount of downtime, as with most things here. It's the combination of how we put things together that's going to make the overall end result. The details you don't need to know about. Obviously, if you're a patient, we're going to go over them with you. But these are all lasers that are, safe to use, don't have a lot of downtime, but when combined, we can address redness, we can address pigment of whatever source, and in combination with medical therapy, we could really give, in a short period of time, a very safe result, where the problems and the scars are better, but also she's not getting acne the same way. Now, the most important thing is maintenance, right?
Maintenance, yeah.
Okay.
So she's following up with topical, one of our custom PFRANKMD topicals, which is a hydroquinone, kojic acid, retinol-based therapy that will address not only the pigmentation, but also the acne, since there is retinol in it. She's been using our UV shade, which is a phenomenal broad-spectrum tinted sunscreen.
Mineral-based for the face. Okay.
Mineral-based for the face. And she's going to follow up in a couple weeks again for a little more light laser, and then we'll tweak and adjust as she goes along. But as long as she's continuing to stay on top of her topicals and doing a little bit of maintenance lasers, we call her cured.
Yes, we like that. Okay, so she's very happy. Again, you got to remember, there's not going to be one pill, there's not going to be one laser, there's not going to be one anything that's going to erase everything. It's really coordinated care between healthcare professionals, board-certified dermatologists, amazing nurses who are experts in skincare and laser therapy, and really getting several heads together to give an overall best result. It's not magic, it's PFRANKMD, so stay tuned.